Okay, so I find there can be a lot of mystery around what labiaplasty is for trans feminine patients. So I would really consider labiaplasty to be an umbrella term, and how I explain it to my patients is a procedure after their initial bottom surgery where we do whatever nip tuck is necessary in order to make things look good. So whether it's a scar revision, whether it's maybe evening up the sides, getting better definition of the labia minora, bringing together the labia majora in the midline, and we'll talk more about this. It's whatever the patient wants or needs to improve the function and appearance of our bottom surgery. So in our patient group, probably about 70% of patients don't actually proceed with labiaplasty. We do, if at all possible, try to do everything we can and hit a home run at the first surgery. However, there are some things we can achieve, and the classic thing would be we cannot bring the labia majora or the outer lips together at the first surgery. However, a lot of girls, this really doesn't bother them because when they stand and bring their legs together, the lips come together anyway. So a lot of patients may not necessarily notice it. Labiaplasty is typically done as an outpatient procedure, meaning you can go home the same day. It's usually nothing nearly as bad as what you put up with at the first surgery. Oftentimes, no more than a week downtime. The exception of this might be if a urethroplasty is required. So your urethra is where you pee from down there, and if maybe there is narrowing of that urethra, it may be necessary as it heals, if you're going to do a revision surgery there, as it heals, to put in a catheter. Usually that stays for about a week, depending on what the patient has had done, but usually not too invasive. And I think the real take-home point is labiaplasty is a very personalized procedure. It's up to the patient herself. You know, sometimes I'll suggest, you know, what is possible, but we start out with what does the patient see and is there anything we can improve upon.